recording this presentation today. Good day, everyone. I'd like to welcome you to our webinar today. The title of our presentation and panel is Tribal Sovereignty and the Children's Advocacy Center Movement. This webinar is being presented by the National Native Children's Trauma Center with grant support from the Office of Juvenile Justice and Delinquency Prevention. The opinions, findings, and conclusions or recommendations expressed in this presentation are those of the presenters and panelists and do not necessarily reflect those of the Department of Justice. It just so happens that today, September 30th, is the National Day of Remembrance for Indian boarding schools. Today, we wear orange to honor boarding school victims, survivors, and future generations. Please join me in a moment of silence in this day of remembrance. Thank you. Such events like the Indian boarding schools implemented forced assimilation efforts that have resulted in historical trauma for tribal communities. Remembering such events, not only today, but every day, brings to light the need to continue to substantiate and honor tribal sovereignty, the topic of our webinar today. We specialize in providing training and technical assistance to systems of care who are enhancing their efforts to implement culturally sensitive, trauma-informed services for American Indian and Alaska Native populations. We were established in fall of 2007 and funded through the National Child Traumatic Stress Initiative and have been part of the National Child Traumatic Stress Network as a Category 2 trauma center, which is a treatment and services adaptation center. Our mission is to co-facilitate trauma-focused healing for Native children, families, and communities. We administer the National Child Advocacy Resource Center, and we not only support tribes in developing CACs, child advocacy centers, and grantees who have been funded to expand their services to American Indian communities, but serve as a resource along with the regional child advocacy centers to those who are not funded but looking to do more work in this area. The Child Advocacy Center movement and individual child advocacy centers have established a strong commitment to the development of culturally responsive services, as demonstrated by this effort's inclusion into the accreditation standards by which we provide services. I know that you all are already attuned to the disproportionalities in victimization and access to services among various racial and ethnic groups. Enhancing American Indian and Alaska Native families' access to child advocacy center services requires an additional layer of understanding that doesn't apply to other groups. American Indian and Alaska Native children and families have a separate status as citizens of sovereign tribal nations. This webinar will provide an Indigenous perspective of what tribal sovereignty is, why it is critically important for children's advocacy professionals to understand, and the many practice implications for children's advocacy centers. Today, we will have panelists who I will introduce later for an informational and conversational discussion on our topic today. And you will have an opportunity to ask questions and learn directly from the presenters after our content presentation. Who is an Indian? When we think about tribal children, there's really no single definition of the term Indian. Each tribe determines who is Indian for purposes of that governments, laws, and programs. American Indian and Alaska Native children may be either currently enrolled, tribal members, or eligible for enrollment. They may be eligible for enrollment even in cases when their parents or caregivers or are not enrolled or are seeking to be enrolled. When enrolled or enrollment eligible children become involved with state child protection systems, the relevant tribes have a legal status as a party to the child protection proceedings and are empowered to assume jurisdiction over these cases. Enrolled or enrollment eligible children living on tribal lands are exclusively subject to tribal jurisdiction. Sovereignty, which is basically the power of self-governance, and self-determination, which is a tribe's right to determine what is best for itself and its people, constitute the foundational framework for tribal legal systems. Tribal economic and community development initiatives and tribal human service systems and agencies all utilize tribal sovereignty to serve tribal children and families. Given that many tribes have not been able to fully exercise sovereignty, when we honor it, we consider this to be healing in and of itself, that we are able to honor this. And that's also one of the principles of trauma-informed care, is honoring that empowerment, voice, and choice. Tribal communities have unique jurisdictional issues, unlike those that apply to other child and family populations. A multidisciplinary team considering cases involving American Indian and Alaska Native children must clearly establish which federal, tribal, and state entities, including law enforcement, child protection, prosecutors, and courts, have authority and under what circumstances. This will all be dependent on the location of the event or events, the type of crime, and the tribal affiliation of both the victim and the perpetrator. Some people have come to call this the tribal jurisdictional maze. Who is an Indian for jurisdictional purposes includes enrolled or recognized as Indian by a government entity and someone who possesses some degree of Indian blood. For states in which Public Law 280 has been adopted, federal criminal jurisdiction in Indian country has been transferred to the state, meaning that the state and tribe share investigative and prosecutorial authority and have location-specific procedures and party-specific responsibilities. Additionally, even this year, in 2022, the U.S. Supreme Court decision in Castro Huerta v. Oklahoma held that the federal government and the state have concurrent jurisdiction to prosecute crimes committed by non-Indians against Indians in Indian country. This decision marks a dramatic departure from the long established status quo encapsulated in the table that you see on the slide. While the Supreme Court ruling will undoubtedly reshape the jurisdictional picture in tribal communities, unless Congress intervenes, it is not clear how tribal nations, the federal government, and states will respond in the wake of the decision. So on the slide here, in the non-Indian perpetrator, Indian victim, 2, 3, 4th row down, when you look at major crimes and all other crimes, those would go to federal jurisdiction. And now, because of this ruling, state jurisdiction will also be applied within that row. So in addition to jurisdictional issues, healthcare, mental health care, victim services, and All other services may be provided by tribal or federal entities, depending on the location and the tribe. Tribes are eligible when they have the capacity and the willingness to assert their sovereignty over various human services that would otherwise be provided by the federal government through things like the Indian Health Service or the Bureau of Indian Affairs. Using federal funds to provide services in ways that they deem best for their people. Some tribes have the capability and desire to bring as many services as possible under the tribe's management, while others continue to utilize federally managed services and providers. What does this mean for child advocacy centers? One of the first measures that child advocacy center professionals can take is to map out the jurisdictional and service array in the tribal areas that they serve. Tribes can enter into various contracts, often called 638 contracts, with the federal government to assume certain services, but not others. So we can build upon relationships, not only with current personnel in the relevant agencies, but with others in those agencies, as well as community members who may be involved or connected to services. Like various communities that we work with, some tribes do rely upon grant funding. Therefore, some services may be provided at certain times and not others. Tribal elders are community leaders and key stakeholders who can help us upon even workforce changeover and can be key sources of guidance for understanding the local context and community. These contacts can allow us to sustain connections amid heavy staff turnover, which is typical among tribal agencies and federal agencies that serve tribal members. These agencies are often understaffed. And so in this place, we have to do extra work to increase and build upon our relationships. That's something that you already know is a foundation to our work. But in building upon relationships in tribal communities, we recognize the historical trauma that communities have experienced of outside entities, and we work to correct these historical negative relationships that have existed in the past and work to rebuild those and create corrective experiences. And that in itself also provides healing in the work that we do. CAC professionals should expect to be patient, persistent, and flexible in building relationships and making arrangements for multidisciplinary team participation. In a tribal community or a community where a majority of the service population consists of tribal members, representatives of tribal and federal jurisdictions and service systems should be the core MDT members. A non-tribal CAC that serves both non-tribal and tribal children should include tribal and federal representatives without necessarily expecting them to be core MDT members, since they have no role to play on cases involving non-tribal children. CACs and MDTs that maximize the engagement of each professional by organizing their case review in this way allows tribes to participate when cases involve their children and ensure appropriate representatives are present to contribute and review. MDTs that do not anticipate having the capacity to review each case might consider prioritizing those involving American Indian, Alaska Native children and families. Such an approach might be justified by the disproportional victimization rates of these children, as well as by the additional challenges that come with jurisdictional service systems and cultural complexities of such cases. If your team can efficiently and effectively investigate, prosecute, and provide treatment to American Indian and Alaska Native victims of child abuse, you will be demonstrating a capacity to address barriers and challenges that will benefit all children in your service population. So how do these issues that we've just reviewed and talked about affect MDT roles and case flows? So these roles may be affected by tribal jurisdiction and service system characteristics, along with considerations for case review and coordination. Law enforcement. Most tribes have their own law enforcement agencies. Additionally, BIA law enforcement or the FBI might have jurisdiction in cases involving tribal children, as we talked about with a jurisdictional maze. So if we can build relationships with relevant personnel, include them in MDT meetings, and if multiple law enforcement agencies, for example, tribal and county or tribal and federal, share jurisdiction, the MDT can play a key role in opening lines of communication and really promoting this collaborative decision-making. In child protection, we see a better enhancement of a working relationship with the child welfare agencies and personnel responsible for services. Without these connections, a non-tribal CAC will likely see its child protection referrals, as well as its ability to gather information and coordinate cases involving these children limited. Children living on tribal lands are not subject to state or county child welfare jurisdiction. Depending again on the location, child welfare services may be provided by the tribe or the Bureau of Indian Affairs Social Services. This tribal sovereignty protection matters, child protection matters is a responsibility that tribes take seriously. The importance of sovereignty is reflected in the policies and procedures, including standards for removals and placement preferences. And you can often find this even in the tribal codes that exist within tribes. Child advocacy professionals should fully be aware of the historical context of child welfare in tribal communities. Those historical implications and events that have happened are important. Data collection, management, and sharing are other points of difference between all of these service systems. Tribal and BIA data are not necessarily part of state child welfare databases and case management systems. And these data are not generally publicly available to even gather basic information. So it does require local coordination. Prosecutors. Tribal prosecutors are invaluable members, integral to prosecuting cases. In addition to prosecuting cases not classified as major crimes, according to the Major Crimes Act, tribal prosecutors often have significant expertise in areas that other child advocacy center professionals do not. For example, tribal prosecutors will typically understand the complexities of local jurisdiction and how to navigate cross-jurisdictional barriers in a way that promotes tribal members' best interests. They might be able to provide necessary guidance about local tribal codes and may be able to talk and coordinate with tribal judges in cases when warrants or orders are necessary. When cases fall under the Indian Child Welfare Act, tribal prosecutors can provide expert advice about the MDT team's responsibilities under the law. Medical and mental health providers. Again, depending on the location and the tribe, tribes that might receive healthcare and mental health care services through Indian Health Service or local tribal health departments or private nonprofit entities. In some locations, tribes might provide medical care and the tribe might be able to provide the mental health care, or IHS might administer the medical care and the tribe might administer the mental health care. So it really depends upon the community in which you're working. With tribal members' eligibility for government-funded care through these providers also comes with restrictions and conditions on access to care through these sources. Children might need pre-approval to be reimbursed for care provided off the reservation or in a non-IHS or non-tribal facility. One way of fostering close working relationships with these organizations is to include them in training opportunities. When MDTs offer training to sexual assault nurse examiners or other medical providers, you might invite providers from local IHS or tribal clinics or hospitals to also be included in these types of trainings. CAC professionals should also be aware of the utilization and access rates for mental health care. Usage rates are often lower among tribal populations, even when care is in sufficient supply. But we all know that this is also another area that's lacking, can be lacking in these communities. Traditional ceremonies and cultural activities, alone or in combination with other mental health supports, may appeal to children and families and open this door to healing. Victim advocates. CAC should seek out victim advocates with local tribal knowledge for these cases. They're to be able to enhance their understanding of all of these different complexities with these service systems that we've just talked about, and their ability to gain relationships with the community to be able to increase access to services and connect people to people for support. So what do we know about the current landscape of CAC serving tribal nations? So we know that available data pertaining to CAC services in tribal communities suggests that American Indian and Alaska Native children are significantly underserved by accredited child advocacy centers. We know that we see American Indian and Alaska Native children experience maltreatment at rates exceeding all other racial and ethnic groups in the United States. If the CAC movement were fully addressing the needs of these children, we would expect to see American Indian and Alaska Native children not simply just overrepresented in the service population, but overrepresented to a degree matching their overrepresentation in the maltreatment data. Instead, according to the data that we have, American Indian and Alaska Native children are not overrepresented in the CAC service population. They account for 1.9% of children served by accredited child advocacy centers in the US in 2021, roughly in line with their share of the national population. This data is going to vary from state to state, and the data, of course, is limited, as we know. But we know overall that where American Indian and Alaska Native children were significantly overrepresented in the CAC service populations, they were not overrepresented to a degree matching their rates of victimization. What are the barriers? To our knowledge, there hasn't been any studies that specifically identify the barriers for access to accredited CAC services. Lots of barriers exist that are outside of the control of the CAC movement to address, given that tribal lands are often sparsely populated or just geographically located far away from services, create logistical issues that might interfere with access, such as transportation and broadband and other types of things like that. Additionally, these jurisdictional complexities may interfere with a CAC referral process or otherwise complicate partnerships with child protection services and law enforcement personnel. It is unknown because some tribes do operate their own CACs and may not have achieved even the minimal piece of accreditation. One barrier that is frequently reported anecdotally and that some CACs do have some power to address is a lack of trust or lack of authentic partnership between tribes and CACs. The CAC movement is relatively new, as you know, and many tribes simply do not know what a child advocacy center is or the services that it provides or how it could be a benefit. Understanding the importance of tribal sovereignty is important because it affects decisions about so many things that happen with children and families. So we encourage people to really work on the operational part of really instituting this partnership in the structure, the policies and procedures, and in so doing memorandums of understanding, memorandums of agreement with tribes that formalize this partnership and in essence substantiates the tribe as a formal partner in this work and articulates best how we provide these services that are uniquely, considers all of these things that we've talked about today. There's not quite in our, when we've reached out to people, there has been MOUs that have been established between child advocacy centers and tribal communities. Some have been established and just not able to be renewed in some cases. There are a few that are really tailored to meet the needs of the tribe and are unique to them in a more lengthier process. And we realize that given the nature of Child Advocacy Center's work, that this work requires a lot to be able to participate in something like this, to be able to have the capacity to do this all alongside doing the work that's being done every single day. But we do encourage CACs to continue to be able to really work towards this. According to NCA, the National Children's Alliance, as of June 2021, 159 accredited CACs served 425 tribal communities, but fewer than 1/3 of these CACs reported tribal collaboration. report having MOUs in place with tribes. So in our efforts, we contacted various CACs who reported having MOUs in place, and we reached out and found that many MOUs that were in place used the same MOU with tribes that they use with other partners, so may not address some of the uniqueness that we've talked about with tribal sovereignty, jurisdiction, and service system access and how to utilize these services. Many MOUs were not updated or could not be located, but people did know that they existed at one time. So we didn't really do a thorough review of everyone. This was a sample of those that we reached out to, and if you are a CAC who has an MOU with the tribe, we would love to speak with you about this and be able to have a place where we can share some of these things to be able to aid in the development of these for other CACs, and so that they can utilize in the future. When we looked at some of the MOUs that we were able to review and look at, there were some elements. One CAC invited each tribal nation they served to provide an addendum to their universal MOU so that it could be unique to each tribal community that they served. And this allowed that CAC to document variations in different community service systems. For example, one tribe had its own social services department administered by the tribe, while others relied on BIA social services, and so allowed to be able to articulate that. The CAC also revised their universal MOU to address inconsistencies in terminology used by the county versus tribes. So they were able to incorporate language on the Indian Child Welfare Act and include clear references to tribally enrolled children through the document, each of which demonstrates a clear understanding of tribal jurisdiction, and also just shows, again, support for tribal sovereignty. Other MOU components included statements about membership on the CAC's board of directors and the intent to organize monthly meetings with representatives from a local tribe to facilitate and, again, formalize that relationship building process. So these are preliminary things that we've discovered, and we plan to continue to have outreach and be able to further fill in these gaps of our understanding. So what are the recommendations from all of that? So we feel like, based upon what we know, universal tribal MOU implementation should be the goal of the CAC movement. We know that some things may delay authentic partnerships, but it's the aspiration that we should be able to develop and maintain a positive collaborative relationship for partnership to formalize this process. So the lack of the MOU we see leaves open the door to question. Sovereign tribes have really the uncontested right to determine what is in the best interest of their children and families. So a CAC that does not consult with tribal experts or agency personnel may appear to be assuming the right to decide these matters, therefore undermining tribal sovereignty. One potential result of this dynamic is that tribal agencies and leaders may choose not to refer children to the CAC at all. And this, of course, what we know might lead to children's risk of negative outcomes. From a tribal perspective, a CAC that does not respect its tribal sovereignty or seek the input of tribal stakeholders is really a threat to the well-being of children, families, and communities. We should pay close attention to the characteristics of MOUs with tribes, really formalize, again, just trying to tailor this as much as possible to meet the uniqueness of the communities that we are working with. And CSA should work with tribal stakeholders, tribal executive boards, tribal councils to seek formal approval of these MOUs. And it really serves as the indicator for any true partnership with a tribe is that signature authority of the tribal government. So we know, again, as I said, we all know that developing relationships are important. It's what we've talked about all along, that we develop relationships with tribal partners intentionally. We know how to do that already in our work as, human service professionals, but we do this more intentionally because we recognize the historical experiences that have happened. So what do? We show up consistently in person, when possible. We increase communication and establish ongoing communication with multiple people, not relying upon one person. We establish these formal relationships beyond tribal leadership that can be sustained beyond tribal leadership turnover. And we become familiar with the tribal codes that are basically the law of the land. So that's really an introduction to this topic. Next, we'll move to a panel that will include Lisa Stark and Kimmy Wind Hummingbird. And I'm going to invite them to introduce themselves, starting with Lisa Stark.
Buju Ginawa, Sagamakwa Indigo Ojibwe Mong Adash Lisa Indigenous Migizi Nidode Mashkizi Bing Nadunjaba. So I shared with you my spirit name. My English name is Lisa Stark. I am Eagle Clan and I am a member of the Bad River Ojibwe tribe from northern Wisconsin. I'm currently a technical and training specialist with National Native Children's Trauma Center. But prior to that, I had worked in tribal child welfare for both my tribe, the Bad River tribe of Wisconsin, and the Lukudere Ojibwe tribe, also of northern Wisconsin. And while I was at LCO, I was a certified forensic interviewer, have worked on a non-accredited tribal CAC, and then it morphed into a CAC in collaboration with the local county and county agencies. So I served on MDT teams in that capacity, and I'm glad to be here today. Miigwech.
Good morning. My name is Kimmy Wind Hummingbird. I'm Muskogee, and I'm joining you today from my tribal community in Oklahoma. So excited to be here. Thank you for having us. Prior to me joining the NNCTC team about a year and a half ago, I worked in Indian child welfare for 22 years. I began as, a kid right out of school on the front lines with those workers and with the families and spent a lot of years in that role. And then I slowly grew through those roles and helped develop new programs and of course policies and procedures that went along with those programs. And then whenever I left my nation as the Director of Children and Family Services, I came to the center. And so all I really know, that's been my life's work, is working within our Indigenous communities, keeping families connected first and foremost to each other, and then of course to their community and to their culture, and the beautifulness that offers to our children, that connectedness to the traditions that we hold dear. I am a kiki to two of the most amazing grandbabies that I could have ever envisioned. And, you know, of course, we talk about praying for those yet to be here, and have prayed for years. And I started with my grandkids, right? Because I'm a little bit proud of them right now. But I also have three adult daughters. They're wonderful, amazing young Muskogee women who continue to make a difference in their community today. And I'm very proud of them, and I'm happy to be here. Thank you for having me.
Thank you both for being here. So I'm going to start asking some questions, but I'd also like to invite our participants, if you have questions for our panelists, if you can put it in the chat, we will be sure to try and get to those as much as possible as well. So our first question for you today, Lisa and Kimmy, is what does tribal sovereignty mean to you?
I can jump right in. I guess maybe we should rotate. I'll go first. So to me, again, working for my nations, I worked for the Muskogee Nation and for the Cherokee Nation in Oklahoma for most of my adult life. And it really meant the ability for nations to govern their citizens and run their programs as they saw fit. We developed our own policies and procedures and our practices to engage with our community members. And I think it's important to note too that I think Megan talked a little bit about it, but we are nations within a nation, and then we're also within a state. So with that comes a lot of challenges and a lot of conversation and open lines of communication, not only with like our governments, because again, they are our founders. They're like in my tribe, we call them a chief, but I know there's many different terms for them, but they are the leader of a sovereign nation. So it's very important when Megan talked about making sure that they're on board and that they understand, and having those lines of communication open with them, because they are the people who determine where the government goes and how to move those relationships and those avenues forward. So it's just about, and serving those communities too. It's about having access to and different types, the way of services, the way that we communicate and engage with our families. So Lisa, what do you think?
Well, I think a common misconception in regards to understanding tribal nations is a lot of times they hear like, well, privileges were given to you or rights are given to you by the US government. Our government predated the US government. That's why Native Americans have the political status we do with the US government through treaties and the treaty process, is because we had our own tribal governments prior to contact. And then when contact occurred, that's when the treaty process came, but we've had our rights and certain practices since time immemorial. So what tribal sovereignty means to me is upholding, like who we are as a people, and being able to just continue to survive and thrive and to live in our own cultural way, and to be able to not only honor our ancestors, or like as Kimmy was talking about, praying into the future, with our future grandbabies, or it's bringing that forward to the future as well.
Can I just piggyback onto what she said too? I know we might do a lot of this, you guys, so I apologize. It's great to hear, and we have some amazing conversations behind the scenes. You wouldn't believe them, but to piggyback on what she said, whenever we're talking about being citizens right of a nation, I want to stress the fact, because we all know that the Indian Child Welfare Act is going to be heard in front of the United States Supreme Court on November 9th. So I want to reiterate the fact that ICWA is not a race-based law. It's about us as peoples having the right to be citizens of nations. It's about our citizenry. It's not about race. And as I mentioned, I'm Muskogee, but I'm also Cherokee. So I have the ability to choose to be either Muskogee or Cherokee, or I could choose neither. So it's about our citizenry. It's about our connection to that tribe. Thanks.
Thank you. Our next question is, can you speak about cultural protective factors and the role that they play within tribal communities?
I'll let you go first this time, Lisa.
Well, just in my years of working in tribal communities, when crisis hits, the community comes together. And it's not only just that tribal community. I recall that a lot of times in my own tribe with our bands, Bad River, we're right on the lake shores of Lake Superior. We also have Bad River running right through, our lands. And pretty much every spring there's flooding, and every couple of years it can get pretty catastrophic. But just being able to see like the other communities coming together when things like that happen, and coming together and, supporting each other, I think that just shows who we are as a people, and that we're more community-based rather than individual-based. And we just work on supporting each other and treating each other like relatives. And I think a lot of our protective factors come from that. And a lot of our resiliency comes from that. We often talk about, in the Western sense, you can talk about epigenetics, but in a cultural sense, we talk about how our ancestors live within us and how we bring that into the future. But just having that built-in resiliency, having that built-in just blood memory of, what happened before, and anything or any of the decisions we make now will affect our future grandbabies like generations from now. So a lot of us are very mindful of that as well. But in that's where our protective factors are, and our cultural factors are as well.
And I mean, there's not much more that I can add to that. I mean, our relationships are a big protective factor within our communities. I know I tell this story whenever I talk about what it looks like within our communities, because, and I always laugh because my kids, bless their hearts, I'm from Oklahoma, bless their hearts. They would be like, gosh, Mom, stop talking about us all the time. But that's, we relate these things to the stories that we can tell. And I can remember my youngest daughter, the first time she went to a birthday party that was outside of our community. And I was a little worried for her because she hadn't really ever, she was like 5 or 6 at the time and hadn't ever been to a birthday party outside of our relatives or close community members. And she went to the birthday party and I was a little bit nervous, and she came back just stomping through the house and she said, Mama, you are never going to believe this. And I thought, oh gosh, I hope nobody was mean to my baby. What happened? And she said, her best friend's name was Kimmy. They're still best friends to this day. So it's funny. So she said, Mom, Kimmy only has 2 grandmas and like 1 aunt. She was in disbelief because our communities, even we don't have necessarily the system that's set up to have just two grandmas, or just the people within our home make up. That's who our family is. We don't function in that manner. We have an extended sense of grandmas and aunties and uncles that always keep an eye out and are supportive of us as peoples and our community as a whole. And it's always challenging whenever I have to take a step back and try to put that into words for people outside of our communities, because we just grow up in that manner. We don't know that it's our norm. We don't know that there's a difference, that connection to everybody's always looking out for each other. The communal way that we practice our child rearing, the way that families practice child rearing, is really something to see. And it's important to acknowledge that there are more people and more, and then sometimes more communities that are involved in raising the child. And We also look about to sometimes whenever our tribes, you're either a matrilineal tribe or patrilineal tribe, and those child rearing practices look different too. So it's important as a professional working in child advocacy that you are aware that there along with different children and different families come different child rearing practices, and you may see things or a practice that may not look usual to you, but it could be very culturally based. So it's important to acknowledge that there are a different set of rules with each tribe as to how they raise their children. And then Lisa talked about the practices that we've had. These are some things that we've had since time immemorial. She's absolutely right. That connection to our culture that is just within us and is supported in that communal way. And it helps us feel whole. And we have that sense of responsibility to our families, to our communities, to ensure that everyone plays their role within our community.
Thank you both. So for CACs particularly and specifically, how do they respectfully and intentionally include some of these cultural protective factors in practice as we serve Indigenous families?
Yeah, so I think it's really important to do your homework. And I know as adults we think, oh gosh, we're already finished doing our homework, but we're not. We should be continuously trying to learn, and specifically engaging with those tribes that work closely or are within close proximity to you. But from time to time, you may see a family that's not a member of that tribe, and it's important that we, as the service providers, are ensuring that we're reaching out to that tribe to learn the best that we can to serve that family. And again, we were talking a little bit earlier about those protective factors and what it looks like in our community. I think that acknowledging that we are not the experts in that community, right? There is no way I, as a Muskogee woman, could possibly know all of the cultural traditions and practices of all the 576 federally recognized tribes, and then the 200 or so more that are state recognized. That's not possible. So it's important that we as community service providers are intentionally working with that tribal nation to see how we can serve their families, checking that bias at the door. We're not the experts in those communities. They are, and they know what works there, and they know how to help and reach their families more than we could.
When I had worked in the tribal CAC that then morphed into like a partnership between the tribe and the county, we were fortunate enough to be in a tribal community where there was an immersion school that taught Ojibwe language, and the children were from like kindergarten, and like it changes, but I think they're up into like the 7th or 8th grade now, but they're working to expand their services all the way to PhD level, but it's taking time. But we had a lot of children in our community who spoke Ojibwe fluently. So when they were being brought for forensic interview services, we had to make sure that our forensic interviewers knew, had at least basics of the Ojibwe language, or had like a lot of understanding of some of the terms that they may have used, especially in regards to, explaining family members or body parts. And we would bring that to our MDT team, and we often provided, like ongoing kind of just like mini trainings. And even we developed little cards that had, the Ojibwe words and English translation that, like even law enforcement can just, it was small and they can fold up and they can keep like in the wallet or their cop cars. So if they needed it at any time, they can look up what those may be. We also worked extensively at ensuring that, like the culture of the community that the MDT team would be aware of. For example, I know like the county prosecutor had wanted to start asking for hair follicle testing because our MDT team also served drug endangered children. But culturally, for the tribal members, that just was not appropriate, and removing any hair could be culturally inappropriate. So we had provided the reasons why, the training, and we went with alternative methods to be able to respect the tribal community as well.
Thank you. When you think about, you've kind of all touched on starting to really honor and utilize cultural humility in working with tribal partners, I'm wondering if you have any more thoughts about how CACs can, cultivate this and continue to honor and utilize cultural humility in the work that they do.
Are you up first, Lisa? Or I can jump in.
Go ahead.
Okay. Yeah, I can't explain enough how important it is to, again, I mentioned it earlier, you're not the expert there. And I working in child welfare for 22 years have had to absolutely learn that as well. Whenever I walk into a home or whenever a family walks in to greet you, they, I don't know what works for them. And I don't know if the services that I have are the best fit for them. So it's important to listen, to ask those questions. How can I help you? And also acknowledge if you don't know, again, we have a responsibility as adult learners to have a solid base, and we'll talk maybe in the as the conversation goes on about how maybe to build that knowledge base. But I think if you don't know, just say you don't know. I'm not sure what the best fit for your family is. As our services offer this, are you aware of any other services that might be more culturally grounded for you and your family? Or, having that background and having worked with those local nations, you may already know some, and you can offer those and say, hey, I know this tribe has a parenting program. This is their contact. Can we get you connected with them? But acknowledging too that we have within our own communities, we have practices that have worked for us for long before a Western influence, and the way that we support each other and support our families. And unfortunately, because of the policies and procedures that were put in place to literally do away with us as humans, to quote, kill the Indian and save the man, we're trying to rebound from all of the continuous trauma and the historical trauma that we still feel the effects of in our communities today. So it's important that we acknowledge that they may have the best fit for their families within those communities. And while we may not see, as an outside agency, may not understand the entire inner workings of that, it's important to acknowledge that that's their way of life, and to allow them to function in that manner, because it's a way for them to connect with themselves and their families, and with their way of life. And again, we know that with those protective factors in place, that they can offer those types of just acknowledgement and return to and build up of the family itself. So, I mean, I would approach in a manner of, how can I help? You can use me as a tool if you need. Is there any way that I can connect you? Is there any way I can support you? Of course, again, be humble. And that's all I can think of off the top of my head right now. Lisa, what do you think?
As Megan had mentioned in the beginning of during the presentation, she had talked about the use of victim advocates. And I can't stress the importance of having victim advocates enough. If it's possible, having a victim advocate that is either from like a tribal community or the tribe has a lot of trust in is invaluable. So when a child is coming in for, like forensic interviewing, and it's an extensive investigation, or it's a higher case because it involves like extreme physical abuse or sexual abuse or that time. These cases can take a long time to get through, to gather the evidence, to get, to the prosecution level. And during this time, the child and the family, especially, there's a lot that they may not understand with the process. They may be experiencing a lot of frustration for, how long it is taking, or during that time, additional needs may be coming up. So maybe it's not only the child that may need some type of counseling or even traditional ceremonies or that, but it can be families as well, because families are going through it right along with the child, and there's a lot to navigate. And when you're a CAC like professional, you're focused on the case, and you can't always focus on the needs of the family. And I've seen victim advocates even being able to just provide, like in-home like care or services or transportation. Or we had a case that actually was going to court where a very young child had to testify, and in front of her perpetrator. And it was a scary process. So the victim advocate actually arranged with, the judge like ahead of time to be able to walk her through what the court looks like, where everyone will be sitting, just, like trying to make her more comfortable and kind of more aware of what was going on and what was occurring. And the victim advocate sat right there with the child and the family as well, because it was a victim advocate who had worked to build that relationship and walked with the family from the beginning to the end of the case, and even beyond the end of the case, where, the perpetrator was convicted, and for a very long time, the victim advocate was still there providing, support for the family. So that is how I would say CACs can help support tribal communities, is really pushing for a victim advocate that a representative that the tribe trusts, or the tribe knows and has respect for, because it helps with the mistrust of all the processes.
Yeah, and we have a rock star on the call today. I know Donald Chi. I mean, he and their CAC really were intentional. They in one story that they shared with us about helping a youth in their area during it was a ceremony, coming of age ceremony that they again, it's also a part about like being a part of the community, to show up and be supportive. Anytime you're invited somewhere, I would encourage you to attend, and just let them know that you're there to be a tool to help support the community in any way that you can. But yeah, I know that CAC that he works with in the South, that they well, not the South, the Southwest, that they were very intentional and wanted to ensure that youth was able to have that ceremony. And so along with some other partners at this center and another community partners, they were able to ensure that happened for that young individual. So
great. Thank you, Lisa. You talked about this already, about who does a CAC need to be connecting with and reaching out to in order to have better relationships and better improve services.
go ahead, Lisa.
I couldn't hit my unmute button fast enough. Sorry. I think it's really important for CACs to build relationships, probably starting with the tribal council or the tribal government first, trying to go in and just talk about what, like services or offers can be, or services can be provided for tribal members. Just showing the respect of the sovereignty and, that nation to nation, negotiating or talking about like, we would like to develop like a partnership with you or provide this with for your families and children of your community. It's also important to be in contact and establish relationships with law enforcement. So if jurisdiction is so complex in Indian country, so it's getting to really know what the jurisdictional issues are in your area, but establishing the relationship, for example, with tribal law enforcement, with the sheriff or the county law enforcement. If it's a jurisdiction where it has federal or FBI, establishing those relationships as well and working together, and just building the trust between all stakeholders, because the whole goal is to lessen the trauma for the children and the families involved. And it's building those relationships, and those include building relationships with tribal communities as well. So reaching out to tribal child welfare, tribal mental health, tribal clinics, tribal doctors at clinics. And as Megan had mentioned, trying to get sane nurses or practitioners in, tribal health settings as well. That is invaluable.
Yeah, and again, Megan had some great information in the PowerPoint, but about those MOUs, right? Those are important too. And the fact that to offer those, we're not all cookie cutter tribes. They're beautiful. They're not better, not worse, just different. All of them are different. And so it's important to acknowledge that because they are sovereign nations. And, hearing what that one center did where they offered them up like a potential form that, hey, if you'd like to use this, you may do so, but please input anything that's relevant to your community or your nation. And so we want to make sure that we're being cautious or aware of the fact that you have your own policies, procedures, and tribal codes, and that they need to align, right? Because we want to make sure that all of that aligns, because not only do tribal programs, or more specifically tribal child welfare programs, don't necessarily have to be very well versed within the state codes and the state's policies and procedures, but they also have their own, the tribal policies and procedures and the tribal codes too, that they have to be very well versed in and abide by, because again, that's what governs that program, is abiding by those policies and procedures. So it's important to keep that in mind too, that there's a lot of different a lot of different avenues that they have to navigate in order to walk alongside you guys as community members. But again, I think just ensuring that they have a voice and that, you're intentional in your work with them. And I think that would most likely start with that MOU as to your intent behind the work that you're going to do with them, and to be inclusive of their traditions and practices too.
Great. Thank you, Lisa and Kimmy. That's all the questions that we have for you today. Is there anything that you would like to add that you didn't get to talk about?
Maybe just some ways that they might be able to tap into those resources. And again, we've mentioned reaching out to council and to those programs themselves, but also sometimes the tribes, they have a cultural preservation department that might be able to provide some information to you. And then of course their websites, the tribal websites, because it's important to, whenever you're doing your homework, that it's coming from an appropriate source, that the information that you're getting isn't something that might not be true in the community, even though it's on Wikipedia or something. And then the tribal elders, my goodness, our wisdom keepers, they are so full of knowledge, and I am just in awe any opportunity I get to have conversations with them. Or actually, I don't have conversations with them, I listen. I don't do much of the talking. I allow them to do that because they're just so rich in their knowledge. And then maybe, oh, there's, if some tribes have cultural museums or cultural centers or libraries, some tribes have tribal colleges. And then, if there's not any local tribal colleges, there might be a Native American Studies department within a local university. So those are some ways that you might be able to tap into those. And if you're in a more urban setting, there are those urban Indian centers that could potentially help your program as well.
I also think it's extremely important for all child advocacy professionals in CACs to have a strong understanding of the Indian Child Welfare Act, especially when you are serving Indigenous children and families. Because of the Indian Child Welfare Act, there are higher standards that need to be met. So CACs need to understand that with opening child welfare cases, for example, there's a higher level of evidence or burden of proof than non-tribal or non-ICWA cases. There is a higher level of providing, in ICWA cases, there is active efforts, where in non-ICWA cases, it's at a lower level at just having reasonable efforts. But for child advocacy centers to really understand those and to just from the get-go, when a case is coming through the CAC doors, and making sure that you're hitting, those burden of proofs, and checking to make sure that, notification has been sent, that, if it's established as an ICWA case, just continue to have those aspects of ICWA on your mind to make sure that the work that you are doing aligns with the regulations of the Indian Child Welfare Act at the federal and in many states at the state level as well.
And another important aspect of the Indian Child Welfare Act is about placement. And sometimes you guys being on the early end of the interaction with the family, they might be more open or willing to have that conversation with you about who maybe, if there is a need to place a child in foster care, who we talked about relationships and multiple grandmas and multiple aunties. There is an extension of family within tribal communities, but you as one of the first people to have those conversations with the family, they might be more open or willing to share some potential placement names with you. And so if the department, whether it's the state or the tribal nation that comes along later, they might say, oh, Kimmy offered Aunt Pam or Aunt Hopi or, whoever, that if just in case, if there's a breakdown in communication later between the child welfare agency and the family, there may be a list already started somewhere.
Well, thank you so much, Lisa and Kimmy, for being part of our panel today and answering all of these questions. I'll say that, if people want to continue to reach out, feel free to reach out to our center and we'll connect you to provide follow-up if needed. So thank you for attending and being here with us today. It was great to spend some time with you.
Thank you, Mado.
Thanks.